Hello and welcome back to AP Psychology. I'm Miss Lee and we are beginning a new unit. We're starting Unit 8, Clinical Psychology, and this is the first section, Introduction to Psychological Disorders and the DSM-5. By the end of this video, you should be able to recognize the use of the most recent version of the DSM, the Diagnostic Statistical Manual of Mental Disorders. This manual is published as the primary reference for making diagnostic judgments. You should be able to describe contemporary and historical conceptions of what constitutes psychological disorders. You should be able to discuss the intersection between psychology and the legal system. This will include confidentiality and the insanity defense. You should be able to evaluate the strengths and limitations of various approaches to explaining psychological disorders. And you should be able to identify the positive and negative consequences of diagnostic labels. And we will pay special attention to the Rosenhan study. If you haven't done so already, go ahead and grab your notes and let's get started. All right, so this is a quote from your textbook that I think is very meaningful to understand psychological disorders. I felt the need to clean my room and spent 4 or 5 hours at it. I would take every book out of the bookcase, dust, and put it back. At the time, I loved doing it. Then I didn't want to do it anymore, but I couldn't stop. The clothes in my closet hung exactly 2 fingers apart. I make a ritual of touching the wall in my bedroom before I went out because something bad would happen if I didn't do it the right way. I had a constant anxiety about it as a kid, and it makes me think for the first time that I might be nuts. This was a quotation from a person diagnosed with obsessive compulsive disorder, and this is again in your textbook. So let's talk about psychological disorders. Approximately 1 in 5 adults in the US, or 43.8 million adults. This is almost 20% experience mental illness in a given year. Approximately 1 in 25 adults in the US, or 4%, experience a serious mental illness in a given year that substantially interferes with or limits one or more major life activities. And these are statistics found on the NAMI website. This is the National Association for Mental Illness. Many disorders like depression and schizophrenia exist in all cultures of the world. So what is abnormal behavior? Why is it so important to define abnormal behavior? If we don't have a good operational definition of abnormal behavior, there's a lot of room for misdiagnosing psychological disorders. And also, haven't we all behaved abnormally at some point? Think about it. Also, who says when our behavior is abnormal enough to present a danger to others and therefore requiring detainment? So these are some questions that we're going to be diving into in this unit. The American Psychiatric Association in the DSM-5 includes this criteria to be able to label behavior as disordered. A behavioral or psychological syndrome or pattern that occurs in an individual reflects an underlying psychobiological dysfunction, the consequences of which are clinically significant distress, for example, a painful symptom, or disability, for example, the impairment in one or more important areas of functioning. It must not be merely an expected response to common stressors and losses, for example, the loss of a loved one, or a culturally sanctioned response to a particular event, like a trance state in religious rituals. And it is primarily a result of social deviance or conflicts with society. So what we have here are dysfunction, distress, and deviance. These are part of a nice mnemonic to help you remember what constitutes a psychological disorder. And they're basically the 4 Ds and a U. There is something deviant about the behavior. It goes against the norm of behavior. It may be abnormal in one culture, but normal in another. It has to be distressful. It has to cause the person or others distress. It disturbs them. It must be dysfunctional. It causes dysfunction in the person's life, or it alters their daily life. And dangerous is that last D. It causes harm to the self or others. And then the U is unjustifiable. It's not reasonable, so it doesn't fit within a normal expectation of what is reasonable. Let's very quickly discuss the history of psychological disorders. Ancient treatments of psychological disorders include trephination, exorcism, being caged like animals, being beaten, burned, castrated, mutilated, and transfused with animals' blood. And just for reference, trephination is boring holes in the skull to remove evil forces. We have seen evidence of this going back thousands of years. Let's talk about psychological disorders from a medical perspective. Philip Pinel, back in the 1700s from France, insisted that madness was not due to demonic possession, but rather was an ailment of the mind. And so this started shifting this idea of psychological disorders more to the medical model, the medical health movement, where mental illness needs to be diagnosed on the basis of its symptoms and cured through therapy, which may include treatment in a psychiatric hospital. So as far back as 1700s, we really started seeing this more of a disease model rather than something that was otherworldly. The biopsychosocial approach assumes that biological, sociocultural, and psychological factors combine together and interact to produce psychological disorders. And this should be a little bit of a review for you. From the biological influence, we are looking at evolution, individual genes, brain structure, and chemistry. The psychological influences include stress, trauma, learned helplessness, and mood-related perceptions and memories. And then social cultural influences include the roles that one plays, the expectations of that person, or even perceived expectations, and then that culture's perspective, the definitions of normality and disorders. And all of these three aspects come together to create a psychological disorder. All of them are influences in the creation or the development of a psychological disorder. So there are, of course, different lenses that we look at when we're talking about clinical psychology and psychological disorders. From a psychoanalytic perspective, this is the belief that psychological disorders stem from unresolved childhood conflicts. And to understand the roots of the disorder, you have to look at the person's early life history. From a behavioral perspective, this is the belief that behaviors are learned responses. And to understand the disorder, you have to analyze how the behavior has been learned and what reinforces the continuation of the behavior so that it can be interrupted. From the cognitive perspective, there's the belief that cognitions, which are thoughts and beliefs, are the root of the psychological problem, and the only way to fix the behavior is to change those thoughts and beliefs. From the humanistic perspective, it's the belief that people are responsible for their own behavior, even abnormal behavior, and so there's a focus on the relationship between individual and society, and how people view themselves in relation to others. This perspective takes on the opinion that the person with the psychological disorder doesn't believe that they have self-worth and that they have had conditions of worth placed upon them. From a sociocultural perspective, there's the belief that abnormal behavior is shaped by family, society, and culture. One's relationship with others can support and even cause abnormal behaviors, and the stresses that one encounters in life can influence the disorders that they have or don't have. So hopefully these perspectives on clinical psychology are review for you. You should be familiar with these perspectives by now. All right, so let's talk about how we actually classify psychological disorders. We do use the DSM-5 at this point, and this is published by the American Psychiatric Association, and it was created to describe psychological disorders. The most recent edition, the DSM-5, which you see a picture of here, describes 400 psychological disorders compared to only 60 back in the 1950s. There are 3 sections. There's an introduction to the book, there's a diagnostic criteria and code section in the book, and this is the actual list of disorders. And then there is a section that is related to emerging measures and models. And so it also talks about how to go about diagnosing the disorder, so the criteria for actually diagnosing someone with a psychological disorder. The goals of the DSM. The first one is to describe those 400 disorders, to indicate how prevalent the disorder is. And this is so that the disorders outlined by the DSM are reliable and diagnosed by different professionals in a similar way. It keeps all psychologists on the same page. It keeps the diagnostic criteria reliable. There is some criticism in the DSM-5 for putting any kind of behavior within the compass of psychiatry into a model of disorder. So now that brings us to labeling psychological disorders. Critics of the DSM-5 argue that labels can stigmatize individuals by assigning arbitrary conditions and value judgments. Major research you should know about includes the Rosenhan's experiment on being sane in insane places. This is also sometimes known as the THUD experiment. So we will be discussing this quite in depth in class, so get ready for that. Another problem with labeling psychological disorders is that the insanity label raises moral and ethical questions about how society should treat people who have disorders and have committed crimes. One thing to remember about labeling psychological disorders is that it can actually be helpful for healthcare professionals who are communicating with one another and establishing a therapeutic regimen. If the psychiatrist and the therapist and the school counselor are all speaking the same language and using the same terminology, it's much less confusing and it's much better to be able to establish and then maintain. There are several categories in the DSM Let's talk about them very briefly. There are anxiety and related disorders, depressive disorders, bipolar and related disorders, obsessive compulsive and related disorders, trauma and stressor related disorders, dissociative disorders, somatic symptom and related disorders, feeding and eating disorders, neurodevelopment disorders, schizophrenia, spectrum, and other psychotic disorders, and then personality disorders. So we will be discussing all of these disorders at some length in the coming videos. What I want you to do here is take a few moments and look over the prevalence of mental illness. This is again according to NAMI, the National Association for Mental Illness. I truly suggest that you go to this website and check out the infographics online. It is ever changing, it is updated regularly, and so the statistics that you see on this screen may actually have been updated since the production of this video. So I do recommend that you go check out NAMI, and you might want to pause here and look over the prevalence of mental illness. I'm not going to read them out to you because I know you can read, but there are some pretty striking statistics in this slide. And that is it for the introduction to psychological disorders. Our next video will dive into some of the specifics of the disorders. I can't wait to see you then. Bye for now.